Hey, everybody, it's Dr. Greg Jones here, and welcome to the Optimization Academy, and not just the Optimization Academy, but the crash course portion of the Optimization Academy. And so I thought I would take some time to, have a few minutes to go over some topics that I think people find interesting or that I want to be able to get more detail in, and just help educate you as a patient so you can, when you talk to your doctor, talk to your providers, you can understand what they're talking about in these topics. So hope you enjoy it, and welcome to the first crash course. And we're going to be talking about peptides. And sometimes I can't wait to talk about peptides because, once you understand how these things work and how powerful they are and how effective they are and how safe they are, sometimes my patients are talking and I'm like, oh, I can't wait to tell them about this peptide so we can, help them understand how they can be part of an integrative plan to get them better, faster, and safer, right? So to understand what a peptide is, first we got to talk about amino acids, right? Because peptides are amino acid sequences between 2 and 50 amino acids in a bound together by peptide bonds that cause the body to perform a certain or specific function, right? And so for those who are watching and not just listening, I am going to put up a picture that I really like to show my patients when I'm explaining what a peptide is. And most of you have heard of amino acids, leucine, valine, isoleucine, the branched chain amino acids. And, you think about amino acids as something that athletes use to recover from workouts, but amino acids actually perform specific function in the body as well. But when they combine together as peptides, that's when they can actually bind to the cell receptors and perform this function. And then peptides themselves, now, I mentioned earlier that 2 to 50 amino acids make a peptide, and once you get above 50, that's where it changes. So the theory is that 50 or more peptides between 50 and 100 amino acids will become a polypeptide, and once you get over 100, you're considered a protein. But different sources will say once you hit 50, it's protein. But at the end of the day, we're using these peptides as signaling molecules. And so an analogy that I think helps people understand it, especially because we're in football season and the playoffs here. Think about the amino acids think about the individual amino acids being your wide receiver on a team, so a single wide receiver, whereas the peptide is your wide receiver group, so it's your 4 wide receivers, 7 wide receivers, depending on what that team has. And then the protein is your entire offense, right? So it becomes a part of that. And so I think that helps people understand is that this peptide is performing a specific function in the body. And what I mean by that, and I love talking about insulin at this point, because insulin is probably the most commonly known peptide. And so when we think insulin, we think diabetic patients, we think about this molecule that helps reduce blood sugar or lower blood sugar, right? But the thing is that the insulin doesn't exactly directly lower blood sugar. So that insulin molecule is not coming to the body and grabbing onto that glucose and bringing it to the cell, like escorting it in. It's actually interacting with a cell receptor, or as we know as glucose transporter 1 and 4, to direct them to basically open up and let the glucose inside the cell. So it's not directly lowering glucose itself. It's telling that cell, whether it be a muscle tissue or adipose tissue, to, hey, I need you to let this glucose in, right? And so understanding that is a big part of knowing how peptides work. Okay, so now that we know what peptides are, the next thing to talk about is what is peptide therapy, right? And so when you think about peptide therapy, it's basically using peptides, specific peptides, to treat a specific condition. So if I know a patient has a condition that can be benefited by peptides, then I want to use that peptide to treat that condition. Now, are peptides the only thing that we're going to use? Probably not, but just knowing that we have an option that's safe and very specific and very individualized for that patient really drives it home. And so really we're thinking peptide therapy is the use of peptides to treat these conditions, and whether that be losing weight or inflammation or arthritis or pain or brain fog or difficulty concentrating, gut health, just so many conditions are benefited from peptide therapy. It's just, it's not so much that we can throw a single peptide, is which peptide and when to use it and how long to use it is where the driver really comes in at. So the next question will be, okay, so most people are familiar with hormones because there's testosterone and thyroid and all that. And so sometimes I'll get the question, okay, when I inject my testosterone, I may have, for these are patients on TRT, they may have the syringe with anywhere, depending on the patient, from 0.4 mLs to a full cc. They're taking thyroid, it could be 15 milligrams, 60 milligrams, 180 milligrams, whatever that is. And so it's a larger molecule. And so when we, like for instance, one of our most popular peptides, the CJC 1295 ipamorelin, you're looking at a syringe with 5 units in it, 0.05 ml. And it's like, wait, how is this little amount of fluid making things happen, right? And I think to understand that, you have to understand how hormones and peptides differ in their mechanism of action at the cell. And this, for the viewers, you'll get to see this picture as well. So to answer that question, we have to understand how peptides and hormones differ in how they interact at the cell and the cell membrane. So for those that are able to see this via YouTube or other avenues, I'm going to bring up a picture showing these two interactions here. So the first one here, we're going to show how a hormone will interact with the cell, and specifically with the cytoplasm and get into the nucleus to make their response happen. So your steroid hormones, let's say testosterone for the sake of this argument here, is going to cross that cell membrane layer and get into the cytoplasm of the cell and bind to a steroid receptor and actually become this hormone receptor complex. And that's going to get translocated to the nucleus and actually cause the cell response that we want, or we should want, by activating what's called mRNA or messenger RNA transcription. So that process is great. It's sometimes a little slow acting, and you may take a larger amount of that particular hormone to make the particular action happen. Now, in the case of a peptide, I found this really fascinating because the peptide itself, because it's hydrophilic, it will not actually cross into the across that cell membrane into the cytoplasm of the cell. It's actually going to bind to this receptor and interact with that receptor via what's called a G protein coupled receptor to cause secondary messenger systems or secondary messenger activation, right? And that actually just speeds it up. Think about it being like an amplifier. So you have this one molecule binding to this receptor, it gets amplified several times until that response, that activity is initiated via those secondary messengers or second messengers, right? And that's a very rapid process because, again, we're injecting a very small amount of this peptide, and their half-lives are really, for the most part, are very short compared to hormones. So understanding that, you understand that you know that peptides are going to work a little bit faster and don't take the same volume to sometimes create a very similar effect in the body. Now, that being said, the next thing I'll get from patients a lot, and I think it's a very fair question, I love answering it, is, are peptides safe? And for the most part, they are, because most of the peptides we use are essentially synthetic copies of peptides our body already makes. They interact very specifically with those cell receptors. So sometimes the side effects are minimized because that peptide is going to interact with the receptor for that peptide. It's not going to bind to a cell receptor that it's not supposed to. Now, are peptides safe for everyone? Not exactly, depending. Sometimes we will not use peptides in pregnant patients, not that they're necessarily unsafe, we just don't have the data to prove that they are safe. And so we try to avoid that. And obviously, if there's someone that has any type of pituitary issue, I don't want to use peptides that are going to stimulate pituitary action. I'm not going to use peptides that are going to stimulate an excessive amount of growth if we think the patient has cancer. There are certain peptides that can be used in cancer, some that you want to avoid. Right. And so also there are peptides that can affect our insulin. And so if I know a person has an issue with their pancreas or insulin resistance, I'm probably not going to do a peptide that's going to put out a lot of insulin or even insulin-like growth factor. So we don't want to do that. Now, sometimes when good people come in, they're raring to go as well. Love hearing me talk about it. They're like, hey, I came to you for these peptides. Can we start these right away? And the answer to the question, can anyone just start peptides? I would say not exactly. It really depends on the environment. Now, the environment, what I mean is, we look at a few things here. I want to look at their foundations of health. So are they eating healthy? Are they getting enough sleep? Are they dealing with stress? Are they dealing with inflammation? Is there any type of cell dysfunction? And not necessarily the peptides won't work, but I want them to work the best. I want them to be the most effective. And so making sure the body is in the right environment to get the benefit from that is going to be, it's going to help our patients even more so that they can feel like, hey, these are really working because I'm ready for it. What I mean by ready for it, in the case of a lot of patients that come in for peptides, it's like, hey, you're very low in hormones. So your testosterone is low, your thyroid, you're hypothyroid, or you've got all this inflammation going on, or your cortisol levels are off. And I'm just like, well, let's get that handled first before we get into peptides, because again, we want them to work the most effective. So peptides, again, can be great for weight loss, but if you have someone that's dealing with inflammation and obesity and metabolic inflammation, like, I don't know, there's certain peptides that, again, that very individualized treatment that can help with that. But a lot of peptides, if you can't combat that, they're just not going to work the best. And meaning that being that inflammation, that inflammatory process, or that hyperoxidative process. So these things need to be addressed first. So not anyone just start peptides. So that being said, man, I hope I was able to help you guys understand what a peptide is, what peptide therapy is, why they're different than hormones, are they safe, and all these cool things. So I'm very excited about these crash courses, and I want to dive into them more as we go forward. So let me know any comments, questions, concerns, any type of quick courses you'd like me to talk about, any other crash courses to go over. I want to hear about it. You can find me on all the social media stuff. That's probably what you're watching it on right now. And I'm excited for the next one. So you guys have a great one, and looking forward to talking to you more about peptides and more things here in the future.